My name is Jenice. I'm 38 years old. I have Crohn's disease, which I was diagnosed 28 years ago at the age of 10. When assessing my risk and starting a new treatment for my Crohn's disease, there's a bit of a process that I personally undergo when trying to evaluate to see if this new treatment or medication is viable for me at this moment and the stage or status of my disease at the time, and to weigh the pros and the cons to see if this sounds like a good fit for me. Just recently, I actually underwent this process in starting a new medication within the last year. So I'm very recent to this and still evaluating within the last year how this treatment is currently working and the continued risks and other issues I'm going to have further along. First and foremost, I listen to my doctors. I have a wonderful healthcare team. It starts with my colorectal surgeon, who has no joking around or putting it dramatically, but he has saved my life. So I trust him hands down in his recommendations. When suggesting that we start medication again for my Crohn's disease in biologics, looking into now the second generation of biologics, as I've had my illness for such a long time, 28 years now, and still progressing. Although my surgeon was familiar with this medication and suggested it as a great treatment for me at this time, he wasn't as informed of it because it is still relatively new and it is second generation. And he doesn't have patients that were on it directly. So he was able to give me some information, definitely led me towards my gastroenterologist, my GI, to speak with him into finding out the specifics about this medication, how it would affect me, and how to prepare for it. And then when speaking with my gastroenterologist, my GI, again, another person on my team that fits in the whole circle, I'm very, very comfortable with him and his recommendations. And he spoke to me. We discussed the pros and the cons, the risks that are with any treatment, and especially when it comes to biologics and immunosuppressive medications, especially with medications with Crohn's disease, are pretty strong. As with all medications, there's risks that you may run into, and you have to, consider them and weigh them, and you won't know how medication will affect you until you give it a try. So that's the down the line that I go first with my healthcare team. I then, go home, do my own research, looking online, looking at the website of directly of the pharmaceutical company or of the medication and treatment. Go straight there to find out to see what they say about their own medication and what's on their website and what they offer. And then last but not least, but most importantly, I feel, is speaking with other IBD patients. I have learned so much through the IBD community, through other patients. That's how you really learn the most. And actually, I have a good friend that I've met through the community that has a very similar history as myself, and she takes the medication also. She's been on it for a while, and I have been able to speak with her and continue to talk to her and get feedback with her and others that are on this treatment on how's it going with you? How did it affect you? How are you feeling? I feel that truly how I've learned the most has been through other patients and speaking with them. So that is definitely high on my list when assessing the risks and everything in medication, is speaking with other people that are on that treatment and on that medication and see how has it worked for them and take that into serious consideration. As when in assessing the risks and starting a new treatment, as I stated earlier, you have to weigh the pros and the cons in seeing if this treatment or medication is going to be beneficial for you at this time. And I think that's very important to do in mitigating your risks and benefit factors in starting this new treatment and medication. Having Crohn's disease or any IBD long term, you're going to go through a gamut of different treatments and medications. And as we all know, is that it could take one thing away, but give you another. So first and foremost, when getting that initial information from your medical team, your healthcare team, when they're suggesting this new treatment, it's important to have them speak to you very directly and clearly of the risk that you may pose for this new treatment or medication. There's the general ones, of course, with any medication. There's the running list of you may have these side effects, yada, 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 yada. But having your healthcare team speak with you directly, like with my surgeon and my GI, I've had them for such a long time. They know me literally inside and out. So they know how specifically more this medication or this treatment would affect me more directly. Because as we know, everybody's body is different, and we don't know how a medication or treatment will work or function until we try it. So I'm always personally open to trying different medications and different things. When you're in a flare-up or have active illness, you're miserable. And you're going to want to try anything and everything to feel better and have a higher quality of life and be in remission. And I always listen to my healthcare team first, as I value and trust their opinion and know, like my surgeon says, that he puts together the A team for me and the best of the best and doesn't let me down. So I definitely take their advice in. But of course, you have to create your own list of pros and cons. And when starting this new treatment, you have to be hyper aware of your body. You have to know going in, what are the things that can happen, the bad things that can happen. Even though they may run at a small risk or small percentage, my doctors always break it down to me, this, and this, and this could happen to you. Most likely more this than that, most likely not. But we speak about all those things of what can and cannot happen and how it would affect me personally more or less in that aspect. And then when trying this new treatment, it's being aware of your body at the time. I'm thankful that I have a team that does not want me overly medicated for no reason. If a treatment is not working and it's making you worse than better, or you're not receiving or feeling any benefits of the medication, my team takes me off. There's no point in taking medications and putting things in you continuously when you've already taken a lot of stuff as it is that are just not helping. There's no point in that. So it's important to, when you're trying this new treatment out, to be aware of what's going on at first, when first starting it, to see if you develop any adverse side effects, or if there is any other long-term risks that, hey, this medication does work, but 5 years down the line, we might have to test for this or keep an eye out for that. As may happen with some treatments, if you're on long-term with Crohn's disease, we do know that. So it's having those things and having your doctor not only think of the present, but preserve you for the future. That's what's important, is having a full picture when making those decisions of what's best for you. So education, I always think, is important, and feeling comfortable enough that all your questions are answered and that you feel well informed and when making that decision of what's best for you at that time. When it comes to understanding the severity of my illness, that has definitely changed throughout the years. As I've mentioned earlier, I was first 10 years old and 28 years ago when I was first diagnosed with Crohn's disease. That was a very long time ago, and a lot of things have changed since then. We didn't have social media, we didn't have the internet, and finding the answers to my questions and having readily available resources was not as readily available back then, or didn't exist. So it was definitely a different time. And being so young, diagnosed with my illness, although understanding it at the time that it was a chronic illness and I had it for a lifetime, with no cure in sight, I was young and optimistic and naive, perhaps a bit, and in the care of my mother, who, for us to get through things, pretty much I was normal, except when I was sick. And that's how I dealt with it then. That was my coping mechanism then. But as I aged and my illness progressed, as I progressed, I came to realize, unfortunately, the hard way, that I have very severe Crohn's disease and that my illness is very active and likes to keep attacking me. So I had to come to learn my body and how Crohn's disease works with me and my body. The way that I have measured the severity of my illness, jokingly, has always been, well, if I'm above dirt and not in the hospital, well, I'm doing A-okay. I'm great. I keep on trucking, right? But it's not as simple as that. Even though jokingly but unjokingly, that is the very reality of our lives and how we measure sometimes this illness that can get so severe. Truly, quality of life is very, very important. It's the everyday things that you're dealing with, because even though you may be in remission and not in a current big flare-up of the illness, every day there's different things that you're dealing with. You don't know how you're going to feel until you wake up that day. You don't know how your Crohn's or your colitis or IBD is going to be that day until you wake up. So there's good and bad days. And I measure my Crohn's and the severity truly with quality of life, which is very important. And the most important thing to be able to provide you that and do all these things is having a healthcare team that listens to you. I'm very, very blessed that I have great doctors, nurses, great surgeon, GI, primary. Those are, the top three that are in cahoots and know each other well and communicate well and know me well and my illness well and how to treat me. They know me inside and out. They know me for a long time, and I have the confidence in them in listening to me and treating me and what I need. And that's really the step one with this illness. It's not easy getting good help in anything, especially in healthcare. So when you find a good doctor, nurse, anyone, any part of that puzzle of your team, you hold on tight to them. And I hold on tight with mine. And I'm very blessed and happy to say that I'm very happy with them. And it's been a process. And, it's not easy always to maintain good help around, but it is essential and number one, because they're the ones that are fighting for me. We as patients know what's going on with us first. We know our bodies. We tell them what's going on so they can then treat us. So having a good healthcare team that listens to us first and then treat us accordingly is essential when dealing with your IBD. And I'm blessed that my team listens to me and helps me out.
Jenice talks about simplifying complex treatment decisions. When you have to make a decision about changing therapy or adding therapy, it's important to have an open discussion with your provider about your concerns and your goals. It's important to read yourself as well as incorporate what your provider tells you about the risks and benefits of the medication. If you just go to the internet, there can be a lot of scary information that is out of context. You need to review the risks and benefits to you and to what your disease is like at the moment. This is a team decision made with your gastroenterologist, sometimes your colorectal surgeon, nutritionist, psychologist, nurse practitioner, nurse. Everyone that's involved in your treatment can help you understand and make this decision. It's important to monitor for side effects of medications. And you should understand how that monitoring is done. It's not just starting the therapy, but what labs do you need to do? What imaging tests do you need to do? What endoscopy do you need to do? What vaccines do you need to take to prevent infection? What healthcare maintenance do you need to do? Perhaps seeing a dermatologist for skin cancer checks, a gynecologist for your pap smears, et cetera. What can you do to reduce your risk and still be on the most effective therapy?